Hello, today we'll be talking about skin lesions. So we'll be talking about macules, patch, papules, plaques, and many more. So let's start. Macule. What is a macule? A macule is a change in the color of the skin. So basically it is flat. If you were to close your eyes and run your fingers over the surface of a purely macular lesion, you could not detect it. A macule greater than 1 centimeter. Macules are never large. They're basically little spots or blemishes in the skin. So basically, if you close this and you try to run your hand through the skin, you're not going to feel a macule as there are no elevations. 2. Patch. Macules bigger than an inch are called patches. So they're similar to macules, but it is because you can see on the diagram. 3. Papule. A papule is a solid raised lesion that has distinct borders and is less than 1 centimeter in diameter. So as we said that macules are flat, papules are raised lesions. So, a description is a solid raised rough lesion that may be red, pink, or brown. Papules may have a variety of shapes in profile, may be domed, flat-topped, umbilicated, and may be associated with secondary features such as crusts or scales. 4. Plaque. So that is a patch of closely grooved papules. A plaque is a solid raised flat-topped lesion greater than 1 centimeter in diameter. It is analogous to the geological formation, the plateau. 5. A nodule. A nodule is a solid lesion with distinct edges that is usually more deeply rooted than a papule. A nodule feels like a hard mass distinct from the skin around it. So basically it is a solid lesion with distinct edges. So you're able to form the edges, yeah? So description is it's a raised solid lesion more than 1 centimeter and it may be in the epidermis, dermis or subcutaneous tissues. You can see in the diagram there. 6. Tumor. Tumor refers to a large nodule. A tumor is a solid mass of the skin or subcutaneous tissue. It is larger than a nodule. 7. Wheal. Wheal is a raised skin lesion that can be itchy and usually disappears soon after it appears. Wheals are generally part of an allergic reaction. A wheal is a rounded or flat-topped pale red papule or plaque that is characteristically evanescent, disappearing within 24 to 48 hours. A wheal is an area of edema in the upper epidermis. 8. Vesicle. Vesicles are raised lesions less than 1 centimeter in diameter that are filled with clear fluid. So description is it is a circumscribed fluid containing epidermal elevation, generally considered less than either 5 or 10 millimeters in diameter at the widest point. 9. Bulla. So bulla refers to a fluid-filled blister more than 5 millimeters, about 3 over 16 inches in diameter with thin walls. In Latin, a bulla was a bubble stud or a knob. A bulla is a large vesicle described as a rounded or irregularly shaped blister containing serous or seropurulent fluid equal to or greater than either 5 or 10 millimeters depending on one's definition of a vesicle. So that's a bulla on the diagram that you can see. 10. Pustule. Pustules are circumscribed elevated lesions that contain pus. They are most commonly infected as in folliculitis, but they may be sterile as in pustular psoriasis. So it's a raised lesion filled with pus usually caused by an infection such as impetigo or boils. Pustule is a small elevation of the skin containing cloudy or purulent material usually consisting of necrotic inflammatory cells. 11. Erosion. An erosion is an eating away of a surface. Erosions are slightly depressed areas of skin in which part or all of the epidermis has been lost. An erosion is a discontinuity of the skin exhibiting incomplete loss of the epidermis, a lesion that is moist, circumscribed, and usually depressed. 12. Ulcer. Ulcer is a lesion that erodes the upper portion of the skin and part of the lower portion beneath. Ulcers can be caused by conditions such as bacterial infection or injury, or form more long-lasting problems such as scleroderma. An ulcer is a discontinuity of the skin exhibiting complete loss of the epidermis and often portions of the dermis and even subcutaneous fat. 13. Fissure. A fissure is a crack in the skin that is usually narrow but deep. An ulcer that looks like a deep crack in the skin as you can see on the diagram. Crust. Crusting is the result of the drying of plasma or exudate on the skin. Please remember that crusting is different from scaling. The two terms refer to different phenomena and are not interchangeable. One can usually be distinguished from the other by appearance alone. So basically, a crust is a dried collection of blood, usually mixed with epithelial and sometimes bacterial debris, serum or pus, also called a scab. A crust is often part of the normal healing process of many infectious lesions. 15. Scale. It consists of flakes or plates that represent compacted, desquamated layers of stratum corneum. Desquamation occurs when there are peeling sheets of scale following acute injury to the skin. So, description is dry or greasy laminated masses of keratin that represent thickened stratum corneum, a dry buildup of dead skin cells that often flakes off the surface of the skin. Diseases that cause scale include fungal infections and psoriasis. 16. Lichenification. This refers to a thickening of the epidermis seen with exaggeration of normal skin lines. It is usually due to chronic rubbing or scratching of an area. Epidermal thickening characterized by visible and palpable thickening of the skin with accentuated skin marking. 17. Atrophy. Atrophy is thinning or absence of the epidermis or subcutaneous fat. It refers to a loss of tissue and can be epidermal, dermal, or subcutaneous. With epidermal atrophy, the skin appears thin, translucent, and wrinkled. Dermal or subcutaneous atrophy is represented by depression of the skin. 18. Excoriation. This is traumatized or abraded skin caused by scratching or rubbing. A hollow crusted area caused by scratching or picking at the skin saw. A punctate or linear abrasion produced by mechanical means, usually involving only the epidermis but not uncommonly reaching the papillary dermis. 19. Scar. This refers to a discolored fibrous tissue that permanently replaces normal skin after the tissue has been destroyed. 20. Keloid. It's a very thick and raised scar is called a keloid. It's composed of mainly either type 3 early or type 1 late collagen. It is a result of an overgrowth of granulation tissue which is composed of collagen type 3 at the site of a healed skin injury, which is then slowly replaced by collagen type 1. Keloids are firm rubbery lesions or shiny fibrous nodules and can vary from pink to flesh-colored or red to dark brown in color. 21. Comedo. A closed comedo is an obstructed opening to the skin and may rupture to cause a low-grade skin inflammatory reaction in the area. The common name for a closed comedo is a whitehead. An open comedo has a wide opening to the skin and is capped with a blackened mass of skin debris. It is commonly known as a blackhead. The primary sign of acne consisting of a dilated, widened hair follicle filled with keratin, squamous skin debris, bacteria, and sebum oil. A comedo may be closed or open. 22. Telangiectasia. A telangiectasia represents an enlargement of superficial blood vessels to the point of being visible. Telangiectasia are the permanent dilatation of superficial blood vessels in the skin and may occur as isolated phenomena or as part of a generalized disorder such as ataxia telangiectasia, small dilated blood vessels that appear close to the surface of the skin. 23. Nevus. The medical term for sharply circumscribed and chronic lesions of the skin. These lesions are commonly named birthmarks and moles. So it's basically a large, irregular, dark brown or black patch associated with malignant melanoma. Some pigmented nevi, such as the blue nevus and the junctional nevus, may be associated with skin cancers but are not widely considered precancers. So basically, we have already talked about the skin lesions in detail. If you're in a hurry and you just want to look at a summary, this is the best slides to look at. Basically, atrophy, thinning of the skin, bullae, a large fluid-filled blister, crusted dried serum or exudate on the skin, ecchymosis, large confluent area of purpura which is a bruise, erosion, denuded area of skin, partial epidermal loss. Excoriation is basically a scratch mark. Fissure is a deepening crack or crevice. Lichenified, thickened epidermis with prominent normal skin markings. Macule, a flat circumscribed now palpable lesion. Nodule, large papule which is greater than 0.5 cm. Papule, small palpable circumscribed lesion which is less than 0.5 cm. Petechia, pinpoint-sized macule of blood in the skin. Plaque, large, flat-topped, elevated palpable lesion. Purpura, larger macule of papule of blood. in the skin which does not blanch on pressure. Pustule, yellowish white pus-filled lesion. Scaly, visible flaking and shedding of surface skin. Telangiectasia, abnormal visible dilatation of blood vessels. Ulcers, deeper denuded area of skin, full epidermal and dermal loss. Vesicle, a small fluid-filled blister. Wheal, itchy raised nettle rash-like swelling due to dermal edema. So primary skin lesions are cysts, fissures, macules, nodules, papules, polypustule, vesicle, wheel. And then if you and just want to look at a summary, you can have a look at this slide, or you could have a look at this slide. So that's all about skin lesions. If you like the video, please like, subscribe and comment. Thank you.